Hey, it's Deanne Newton here. Happy Tuesday. I hope you're having a wonderful day. Today, I wanted to talk a little bit about irritable bowel syndrome, also known as IBS. And this makes up about half of the complaints of any kind of gut issue that we have. And women are two times more likely to have IBS than men. And usually the diagnosis is given to people less than the age of 50, but you certainly can continue to have these symptoms over the age of 50. So let's talk a little bit about what IBS is. Now, it was always a diagnosis of exclusion, meaning when physicians did not know what was going on in your gut and you were having all of these symptoms and they kept doing tests and everything looked fine, then they would finally give you the diagnosis of IBS. And I got my diagnosis back in 1992. I was having horrible bouts of really bad cramping that I would literally have to get into the fetal position for several hours until it just decided to go away. And I had lots and lots of constipation with mine. Now, there are different types of IBS. And what happens is you usually have specific symptoms. So let's go over that first. So abdominal pain. And this can be anywhere in the abdomen. It can just be slight pain. It can be excruciating pain like mine was. You can have it every day. You can have it once a month. It can just be, it can be different for everyone. And a change in bowel habits is very common. So all of a sudden you've kind of been going along having a very normal bowel habit and then it changes. All of a sudden you become very constipated, or all of a sudden you're having lots and lots of diarrhea. Or you could have a combination. You could keep going back and forth. And now, today, we actually have separations of IBS. You might hear a physician call it IBS/C, or you might see that in your medical notes. And that means IBS that's prevalent. The prevalence is constipation, or you might see IBS-D, and that's the prevalence is diarrhea. You can also have the combination. So, just to let you know about that. Gas and bloating, a big part of this. Your bowel habits just feel off. You're just not really, it's not consistent. Headaches, fatigue, anxiety, and depression. And you may think, well, that's kind of weird because I think of that as being more of a head thing. Well, first off, 80% of our immune system is in our gut, in our large intestine. And as you probably heard, the gut is often considered our second brain. Our brain here and our brain in our gut, they're very closely attached. They communicate through nerves. And so when you have a problem in your gut, it will definitely go up to the brain, and you can have issues such as headaches, brain fog, fatigue, depression. So just know that can be originating in the gut. All right, so what I always recommend regarding IBS is that you visit your doctor because we do want to rule out anything more problematic. So when I went and I kept complaining, they did a colonoscopy to make sure everything was going on fine in the colon. They want to make sure you don't have something like Crohn's or ulcerative colitis. That's an inflammatory process in some part of the digestive system. They'll definitely want to rule out polyps. They definitely want to rule out things like cancer. So it is important to go ahead and see your doctor to rule out anything that needs immediate care. So now let's move into some reasons why you may have these problems. And number one is food sensitivities. So that can be caffeine, that can be dairy, that can be any type of food. In our intestines, we have the lining of our intestines, and there's something called tight junctions. And they're very tight, and they don't allow too much to move through that wall into the bloodstream. And that's important because we don't need invaders getting into our bloodstream. But unfortunately, there's certain things, certain foods, certain pathogens, stress, alcohol that can actually cause those tight junctions to loosen. So then food can move through the wall and other things can move through the wall into the bloodstream, and that can cause issues. Now, if there are large undigested particles of food that are moving through, the immune system will not understand what that is, and it will actually develop antibodies against that food, and it will start attacking that food. Hence, you've got a sensitivity to a specific food. So if you continue to eat that food, you will continue to have problems. And you really need to seek help to really understand that. Or if you know that you eat the same food often and you don't feel well after that food, that is a very big warning sign that you should probably remove that food and see how you feel. The next one is stress. Stress, again, is going to cause problems with the wall. Stress is going to cause problems with digestion in general because when we're in stress, our autonomic nervous system switches into what's called the sympathetic nervous system, and that's the stress response. And that's for us to, get things done. We don't digest when we're in that part of our nervous system. We need to be in the parasympathetic nervous system. We're relaxing where we are when we sleep. So if you're constantly stressed out, your body is not able to digest, and movement through the system is not able to happen as it should. Diet. Of course, what you eat is always going to affect your digestive system. And that's what I thought was very annoying when I went to the doctor back in 1992, because he just told me, hey, you need more fiber. And I was trying to specifically figure out what foods were good and what weren't. And of course, he could not tell me, mainly because he just doesn't have the education, the nutrition education. So he really didn't know what to tell me. But we know a lot more today than we knew back then. And yes, food has everything to do with these symptoms. So you may not be getting enough fiber. If you're eating the standard American diet, you're probably taking in too much sugar. You're taking in too many processed foods. So things that come in a bag and a box, things that aren't filled with nutrients, not filled with vitamins and minerals. So eating different foods is important. Now, when you turn around and try to add more food, if you're all of a sudden trying to add a lot of fiber too quickly, you will also have some problems. So if you're not eating any fiber at all, it's definitely something that you have to do slowly. And lastly, infection. You could have some kind of infection that set this off, that was a trigger for this IBS. That could have been a bacterial infection. Maybe you had food poisoning, a viral infection. Maybe you traveled somewhere and you ate some food that had some kind of problem with it. Maybe you have a parasite. Maybe you have candida, you have yeast in your system. So any of those things can be a trigger for this IBS and these symptoms that you're having. So, what can you do? Ways to improve it. Stress management, always important. We should be in our parasympathetic nervous system, our relax and digest system, 80% of the day. We really only need to be in our stress response really for survival. But unfortunately, the way we live these days, it seems like everything sets us off into that stress response. Paying bills, worrying about getting somewhere in a certain time frame, driving on the interstate when there's a lot of people around. So you can do certain things, and I talk about this a lot in this group about how you can manage your stress, different ways to calm yourself down to get into that parasympathetic nervous system. So really, really important. Eating smaller meals and making sure that you chew. So when you eat smaller meals, it's going to be easier to break down the food that you are taking in, all the way down to the really small particles that are the vitamins and minerals. And when you chew, you're also breaking down the food as much as possible. We have certain enzymes in our mouth that come from our pancreas that are in our stomach, and those need to be released in order for our foods to be broken down. So that just helps our digestive system work properly. Now, another thing you can do is drink some bone broth before your meals or throughout the day. You just heat up the bone broth and you actually drink it down, and it's full, full of nutrients. And that is actually something that can heal the lining of the gut if you're having problems there. And then, of course, avoiding caffeine, dairy, and sugar. We talked about before because these things can be problematic for the lining of the gut. So take these out of your diet for a good 3 weeks to 4 weeks. Drink your bone broth, and you're going to get some healing there. And that may be something that really, really helps. And lastly, it's very, very difficult to do this on your own because it's very difficult to heal the damage that's been done. And it's also difficult to really pinpoint what foods may be problematic, as well as to get really deep into your stress management. A lot of times we need someone to look at our beliefs and our thoughts. A lot of times we have barriers that keep coming up. So we say, I can't take that food out of my diet. There's just no way I cannot eat that. Or, I have this busy job. I can't change anything about it. This is just the way it is. And actually working with a coach to kind of help you change those beliefs and thoughts can really be a godsend and can really transform not only your health, but your life. So seek out a functional medicine provider, can be a PA, a physician, a coach, a nutritionist. I am all of those things. I'm a PA, I am a coach, and I'm a nutritionist. So I'm here to help you. So please, if you need help, just ask. All right. I hope that that answered all your questions about IBS. And I hope you have a wonderful Tuesday. And I will see you later. Bye bye.